my name is Jessica Michaela Dolvais Ventura, and today I'll be reporting about Hyperemesis Gravidarum. The content of my report are the definition, the risk factors, the signs and symptoms, the diagnostic tests, and the nursing interventions for the said condition. First, let me discuss the definition. Hyperemesis gravidarum is the prolonged and severe nausea and vomiting during pregnancy. It can occur around or between 4 to 12 weeks of pregnancy and can extend up to 12 weeks. It can cause severe dehydration, ketonuria, lightheadedness, weight loss, and electrolyte disturbances or imbalances. In short, hyperemesis gravidarum is the excessive vomiting during pregnancy. Vomiting can be normal during the course of pregnancy, but when it is excessive, it can cause a lot of discomfort to the patient. What are the risk factors of hyperemesis gravidarum? First is the occurrence of hyperemesis gravidarum during an earlier or former pregnancy, having other women in the family developing the condition, being overweight, having multiple pregnancies, or being a first-time mother, having their pregnancy at an early age, around teenage, and having the presence of trophoblastic diseases which cause abnormal growth of cells of the fetus. Examples of trophoblastic diseases are hydatidiform mole forming in the pregnancy. What are the signs and symptoms? I will now be listing them. First is vomiting for more than 4 times a day. Next is losing more than 10 pounds or 5% of current weight due to excessive vomiting. Next is dehydration, feeling thirsty, fatigue, heartburn, dizziness, lightheadedness, vertigo, elevated temperature, having a fruity breath smell, oliguria or the lack of urine that is accompanied with a dark yellow color and a strong smell. Lastly is hypotension or the dizziness, especially when standing or changing position. What are the diagnostic tests, or how is hyperemesis gravidarum diagnosed? First is through patient interview with the healthcare provider, having been stated the medical history and the symptoms that the patient is feeling. Next is through physical examination, followed by a complete blood count, a serum electrolyte test to test or examine the amount of fluid and electrolyte in the body, seeing if there are any imbalances. Next is ketones urine test. This is to measure the amount of ketones present in the urine. And lastly is ultrasound to detect or confirm the multiple pregnancies. Lastly, we can talk about the nursing interventions. So here are the responsibilities of the nurse. First is to monitor the fluid status, taking the intake and output of the patient to ensure that there is no dehydration, monitor the vital signs to check the well-being of the mother, and monitor the fetal heart tone to check the well-being of the infant. Next is to weigh daily to detect any weight loss of the mother. Next is to assess for signs of dehydration and electrolyte imbalance such as severe thirst, dry skin, poor skin turgor. Next is to provide comfort measures because hyperemesis gravidarum can cause a lot of discomfort. Next is to provide a vomiting pail or pan near the bed to prevent choking and aspiration when rushing to the bathroom. Nurses can also give nutritional recommendations such as progressive diet after stabilization to regain the lost weight, or next is to provide vitamin B6 to help with the vomiting, but this should be prescribed by the doctor first. Next is to give small frequent meals that include dry bland foods such as crackers and dry toast in the morning before rising from bed. For severe cases, there is a need for parenteral solution in the case of an IV solution to provide vitamins and nutrients such as substitute for food. And for medication options, the first-line medications that we have are pyridoxine and doxylamine, and other medications, if the first-line medication do not give relief to the mother, are a combination of antihistamines, meclizine, diphenhydramine, dopamine antagonist, droperidol, and metoclopramide. So here are my reference, and this ends my report. Thank you so much for listening. Have a good day.